of it. When I say non-medical, I'm talking about not even including side effects of anything. Just general day-to-day what you're going to have to face.
I was using a catheter that was generally in practice in the hospital, that there's a part of the catheter that allows for the drainage from inside that's inserted in you that seemed to have little barbs on it because it wasn't finished very well. Because of course it was inexpensive. And on putting it in and pulling it out, it was like with a fish hook. And with the new tissue, that was extremely painful and uncomfortable. So after a while, I said there had to be a better way. And I started asking questions and found the variety of catheters that were available in the marketplace, and decided it didn't matter the cost. I needed to have less damage and more comfort when I was catheterizing.
PSA is simply an indicator, and it is not the final diagnosis. You still have to go through all the other exams and the biopsies to figure out how bad it actually is. And then I think that the biopsies, I think, are one of the more accurate methods of finding out whether or not how severe it is.
First of all, don't smoke. I'm not so sure that that has a great deal of effect on prostate cancer. I'm sure it does, because it does affect other cancers. I think also looking at one's health, like in other words, I think that we somewhat intuitively do know what we are doing to our bodies, and therefore deal with what you believe is not beneficial for yourself, whether you need to exercise more, whether you need to eat less or whatever. Like, I think that there is something intuitively that we really do know, but yet we don't do it. And I believe that that's what we really need to look at more than anything.
And we've cut back a lot on some of these foods, vegetables, fruits that may have pesticides on them, or we're doing a lot more cleaning. We've changed the diet a lot.
Diet and exercise, two important things. And stay away from things like red meat and that sort of stuff. Mental, always have a positive attitude in those things. Anyone diagnosed with cancer, absolutely you have to have a positive attitude towards it.
The two things that I would tell people from a non-medical point of view is, and I think this applies to all cancers, is there's no doubt in my mind nowadays that we should be very careful and make sure that we are eating the right sort of foods and diet, and have a good diet. I think that's very important. I think people tend to underestimate how much of our foodstuffs could in fact be causing cancers, not just prostate cancer. I think the second thing is people need to remember to keep fit. The fitter you are, the better your immune system is. The better your immune system is, the more likelihood you have of shrugging these diseases off. Your body needs to be fit. Your system needs to be able to take the dead cells and throw them away. And it's the dead cells that cause the prostate cancer or cause any form of cancer. They multiply and eventually become cancerous. If you're fit, if your body's working more or less the way it should, then I think you have the best chance going that you won't develop these diseases.
But don't design your own exercise routine. Do a little research. I changed my routine completely so that I could be doing the right things. And fortunately, Princess Margaret has this marvelous survivorship program that has, and they've been doing very careful research as to what kinds of exercise, at what stages, for what treatment modalities, and that research is ongoing. This is the kind of, that's what gets funded by these motorcycle rides and all these mustaches in the month of November and the runs that happen. This is exactly what's being funded, and I can tell you from personal experience that is improving my quality of life and probably the length of my life as well.
Yes, I've changed some of my diet, but not excessively so, mostly because I feel the quality of life that you have left is, to me, far more important than the quantity of life. And the better quality you can put your life into through some better eating, some exercise, looking after yourself physically. I truly believe in look good, feel better. It's not my motto but one I've adapted to. And it's worked really, really well.
And I think you have to be comfortable with the person doing the operation.
We don't really look at our bodies. We look at them, we don't treat them with the same respect as what women do. And how do we educate men at an early age to start appreciating their bodies and working with their bodies, paying attention to their bodies, the awareness and whatever that perhaps can prevent cancers, heart diseases, or whatever. That's what I would like to see. Somehow, men becoming more educated and aware.
You know, we're polluting this planet at a ferocious rate, and it is causing more cancers. I have no doubt about that. Dave Suzuki sent me an email when he heard of my diagnosis and said, you know, it's terrible news, I hope you get well, but if we stopped treating the planet as a garbage dump, you know, nature wouldn't be striking us back in the same way. And I think he speaks the truth. Some of the links haven't been directly drawn, so companies are out there profiteering, sometimes without having done the research, a lot of the time, so that we could know with certainty what the multi-generational impacts are going to be. And I have no doubt that the pesticide, you know, my dad was a golfer. He used to have me, you know, we would be putting DDT on the dandelions in our lawn in the 50s, you know, watching the ads of the happy couple. Well, you know, 40 years later, is that what's giving us breast cancer and prostate cancer? Who knows?
Be prepared that things may not always go the way you want them to, and to remain as focused on one foot in front of the other as you go. Because it's a journey where we really don't know the end. But it is a journey, and it's one you will take with those around you. Be aware of those around you and their feelings, and respect them, and hope that they will respect yours.